Hello, welcome to the lecture of the Department of Microbiology and Virology. Today's lecture is about causative agents of anaerobic infections, their morphological and antigenic characteristics, algorithm of microbiological diagnostics, methods of microbiological diagnostics, microbiological approaches to prevention. Clostridia, gram-positive obligate anaerobic spore-forming bacteria whose spores are larger than the diameter of the cell and therefore take the form of spindle, tennis racket or safety pin. Clostridium belongs to the family of Clostridaceae, genus Clostridium. The genus Clostridium unites more than 20 species. Some species of Clostridia are part of the normal microbiota of the gastrointestinal tract, found on the skin and in the oral cavity. Pathogenic Clostridia include causative agents of botulism, tetanus, gas gangrene. Gas gangrene. Anaerobic clostridial infection is a severe wound infection in humans and animals. The disease is polyetiological infection that occurs when wounds are infected with certain types of Clostridium, several types of Clostridium, associations of Clostridium with different types of aerobic and anaerobic microorganisms. The slide shows a table on the causative agents of gas gangrene. According to morphological and tinctorial properties, all pathogens are large, gram-positive rods. In addition to Clostridium perfringens, all pathogens have mobility, peritrichous, but do not have a capsule. Since the main causative agent of gas gangrene, Clostridium perfringens, let's dwell on the properties of this pathogen. Clostridium perfringens is a large gram-positive polymorphic rod, stained well with methylene blue and other basic dyes, no flagella and is immobile. Cultures freshly isolated from the body have a capsule. When exposed to unfavorable conditions, they form oval-shaped spores located centrally or subterminally. All cells become gram-negative, do not perceive methylene blue and stain with fuchsin. Pathogenicity factors. The main factors of Clostridia pathogenicity are exotoxins and aggression enzymes. Different types of Clostridium synthesize a different set of exotoxins. These exotoxins have hemolytic, necrotizing, and lethal effects. Enzymes of aggression such as lecithinase, DNase, hyaluronidase cause tissue breakdown. Cultural properties. On solid media they form S colonies are round, juicy, domed with smooth, even edges. Later the colonies become cloudy, grayish-white. R colonies of irregular shape, bumpy with uneven, rough edges. On this medium, Clostridium perfringens form black colonies and Clostridium histolyticum form greenish-black colonies. On blood agar, colonies with a raised center and a zone of hemolysis. On the Kita rhodsa medium, grows after 3–8 hours with the formation of turbidity and rapid gas formation. High proteolytic activity. Intensively curdle milk after 3–5 hours with the formation of a large cell spongy clot. In the column of agar, lentils, airplane, on liquid media, diffuse turbidity, decompose glucose, ferment lactose, maltose, sucrose, and hydrolyzed gelatin. Microbiological diagnosis of gas gangrene. The material for the study is wound material, wound exudate, and blood. Zeisler, Wilson Blair, and sugar agar media are used for inoculation. Next, a pure culture is isolated and identified. A neutralizing reaction is used to detect the toxin. Also, to determine a specific antigen, an immunofluorescence reaction is performed. Bacteriological method. The detection of Clostridium perfringens in an amount of 10 in the power of 5 in 1 gram of the product or 10 in the power of 6 in 1 gram of feces indicates their etiological role in food toxicoinfection. Identification is carried out by a set of standard tests, mobility, serological reactions, PCR, and etc. The toxin was previously identified using a neutralization test in animals and is now practically not used. Prevention. For specific prevention, in order to create artificial active immunity, xenotoxin is used, which includes tetanus toxoid, botulinum toxoids of types A, B, and E, as well as Clostridium perfringens and Clostridium novi anatoxins. Tetanus is an acute infectious disease with damage to the motor cells of the central nervous system with the development of tonic and clonic seizures. Clostridium tetani habitat the intestines of animals and humans from where they enter the soil, where they vegetate or form spores. Morphology of the causative agents of tetanus. Movable stick with rounded ends. Forms large terminal spores resulting in the appearance of a drumstick. Motile. Pertuchus has more than 20 flagella. It stains well with all aniline dyes. It stains positively according to Gram, but Gram-negative individuals are also found in all cultures. Stain badly. When stained with methylene blue or Gram, the spores look like rings. Antigenic structure. According to the antigenic structure, the causative agent of tetanus is heterogeneous. Group somatic O antigen. Type-specific flagellar H antigen, according to which 10 serological types are distinguished. They all produce the same specific toxin. Pathogenic factors. The main factor of pathogenicity is exotoxin. Exotoxin components. Tetanospasmin affects the nervous tissue, suppresses the release of inhibitory neurotransmitters in synapses, which leads to hyperexcitability of nerve endings and the development of muscle spasm. Tetanolizine lyses red blood cells, has a cardiotoxic property. The lethal dose for a mouse is only 3 multiplied by 10 in the power of -11 gram. For example, 1 milligram is enough to kill from 50 to 70 million mice. The ability to toxin formation is encoded in the plasmid and expressed differently in different strains, from non-toxigenic to highly toxigenic variants. The test material for tetanus are pieces of tissue from wounds, wound discharge, blood, sectional material, dressings, and soil. The study is carried out in 2 directions. First, detection of the toxin by setting up a bioassay. Second is isolation of the pathogen. To detect the toxin, a biological neutralization reaction is carried out on laboratory animals. Antitoxic serum is used to neutralize the toxin. Subcutaneous injection of the test material filtrate into mice in the presence of toxin leads to muscle spasm and body curvature towards the site of toxin injection. Detection of the pathogen is carried out by bacterioscopic and bacteriological examination of the material from the site of the entrance gate of infection. Bacterioscopic examination is aimed at detecting microbial cells in the forms of drumsticks, in smears or smears imprints. A bacteriological study is carried out by inoculating the material on the kid tarotse medium, followed by reseeding on solid media to isolate a pure culture and study its properties. As an express diagnostic method, the reaction of immunofluorescence of smears and smear imprints from the wound is used. Specific tetanus prevention can be planned, which is active immunization of children and adults, and emergency, which is post-traumatic. Plant-specific prevention of tetanus in children begins at 3 months of age, followed by the introduction of the vaccine at 4 or 5 months and at 6 months. Revaccination is carried out at 18 months, at 7 and 14 years. Routine vaccination is carried out in accordance with the national calendar of preventative vaccinations. Botulism is a severe food toxicosis that develops after eating products containing botulinum toxin. The disease is characterized by the development of paresis and paralysis of the striated and smooth muscles as a result of the blockade and acetylcholine release in neuromuscular synapses by botulinum toxin. Morphological properties of Clostridium botulinum. Vegetative cells are large, polymorphic rods with rounded ends, gram-positive. Spores are oval, large, located subterminally in the form of a tennis racket. Do not form a capsule and is mobile. For the cultivation of Clostridia, a liquid Kita-Rotse medium is used, as well as solid nutrient media, which are liver agar, iron sulfite agar, Zeisler's glucose blood agar, and cultivation in anaerostats. In the environment of Kita-Rotse and mid-pipton broth under anaerobic conditions, the growth of Clostridium botulism is accompanied by uniform turbidity. On liver or sugar agar under anaerobic conditions, Clostridium botulism forms rough, R-shaped colonies. On blood agar, the causative agent of botulism forms colonies with smooth or jagged edges and a shiny surface surrounded by a zone of hemolysis. On Wilson-Blair medium, Clostridium botulism under anaerobic conditions form black colonies due to the formation of iron sulfide under the influence of hydrogen sulfide produced by bacteria. All types of the causative agent of botulism produce gelatinase and lecitinase with the formation of an iridescent corolla around the colonies. Antigens. Clostridium botulinum have a group-specific flagella H antigens and type-specific somatic O antigens that do not show toxic properties. The study of the antigenic structure of bacteria during identification is not carried out. According to the structure of exotoxins, Clostridium botulinum is divided into 8 serovars. Man is affected only by toxins A, B, E, and F, which are harmless to mammals and birds. Toxin A is especially dangerous, the lethal dose of which for humans is only 10 in the power of -8 gram. 6 kg is enough to poison all mankind on Earth. Laboratory diagnostics is primarily aimed at detecting the toxin and determining its type. Isolation of the pathogen is a secondary stage of research. The test material in the diagnosis of botulism is gastric lavage, blood, vomit, feces, urine, sectional material, food residues. The blood is examined for the presence of toxin. To isolate a pure culture, pathological material in addition to blood is inoculated onto nutrient medium. Antitoxic antibodies in the patient's blood can be detected using an indirect hemagglutination test. Also, polymerase chain reaction and enzyme immunoassay are used as express methods for diagnosing botulism. To detect a toxin in the test material, a toxin neutralization reaction on laboratory animals, which is bioassay, is used. White mice are used to detect toxins for each sample. One animal is subcutaneously infected with only the test material, and the remaining mice are infected with a mixture of material from antitoxic diagnostic serum of different types, A, B, and E. Preliminary mixtures are kept at room temperature for 40 minutes. to neutralize the toxin with antitoxin. Animals are observed for 4 days. If there is a toxin in the material, all animals die within 4-5 hours, except for the mouse that was injected with a mixture of toxin and homologous antitoxic serum. Prevention of botulism. Non-specific prophylaxis includes a set of sanitary and hygienic measures aimed at preventing the ingress of bacteria and their spores into food products. Compliance with sanitary and hygienic rules in the production of food products. Specific prevention. Active immunization. For vaccinal prevention of botulism, botulinum polyanotoxin is used, which is part of complex vaccine for the prevention of anaerobic infections. Passive immunization. Following the pathogenic logic, patients are injected with antitoxic sera against toxins that dominate in human botulism, but having a preventative effect, they bring little benefit in the fight against an already developed disease. As with tetanus, a toxin translocated into neurons is not available to antibodies. For emergency prophylaxis, polyvalent horse serum is used, produced in liquid and dry form. A single injection is usually not enough, so it is administered daily until a clinical effect is achieved. After laboratory detection of the serotype of the pathogen, serum only against this type. So that's all for this topic. Thank you for your attention.